Massachusetts' rollout of recreational marijuana sales has been a long time coming. But with just 2 licensed retailers open in the state, demand has been high and patience is starting to run low. Out-of-towners have been overrunning shops in Leicester and Northampton, pushing their neighbors to the brink with all the crowds and the traffic.
I mean, you're talking hundreds of cars for the last 7 days.
We actually had one couple that stood up and said somebody had urinated in their front yard. That's unacceptable.
Since an emergency meeting earlier this week in Leicester, traffic has gotten a little better, but most would agree high demand and limited supply, with just the 2 stores bringing in more than $2.2 million in sales in their first week alone. So what's next? And should legalizing pot be just the first step towards legalizing other drugs? Shaleen Title is one of the commissioners on the state's Cannabis Control Commission. She also co-authored the ballot question that brought us legal marijuana. Shaleen, it's great to meet you. I'm glad you're here. You're wearing 2 hats tonight, we should say. We're going to talk to you in your public hat as a commissioner, and then I want to talk to you as a citizen in a couple of minutes. In your public hat, if I can, I've been critical of this rollout, saying, it took 2+ years for medical marijuana, even though there was no commission then, I should say. 2+ years to open the first 2 pot shops. Are voters and people like me, including people like me, right to be peeved about the slow pace of the rollout or no?
The voter in me feels impatient. 2 years seems like a long time. But if you look at the process that has been public, that we've been transparent about, it's largely in line with what other states have done because, of course, there was a delay from the legislature. We're a brand new agency, had to hire all of our staff, have to comply with all of the regulations. So here we are about a year since we were appointed. We've done hearings, written the regulations, and now the first 2 stores are open with many more to come.
But places like Nevada, I think it was 8 months, California 14 months after the voters spoke. So even though the legislature took a while to get this process going, we have had to wait longer than most other jurisdictions, have we not?
Certainly, and I've been waiting 10 years since I started working on this issue, but it's been about a year since we were appointed, and there were many other things that we needed to do.
Speaking of working on this issue, you're sort of the champion, I think it's fair to say, of the social equity part of this. And for those who don't know, the whole notion that those who have suffered most under pre-existing drug laws should be among the first in line to benefit from this. But so far, not so good. At least from what I understand, the first 2 pot shops are white-owned, are they not?
There's only 2 shops. It's a little early, I think, to be making judgments, but you're absolutely right. So when the appointing authorities appointed the commission, there were 5 different subject areas that we had to have expertise in. Public health, public safety, government regulation, business, and then social justice, which is my seat. And so we come at all of our decisions from those perspectives, and it's very important to us that this brand new industry should be equitable, and we should acknowledge and address the racial disparities.
Well, it's statutorily required, is it
of
not?
Course.
Based on what you draft. But you mentioned that we only have 2, obviously it's only 2 shops, but didn't I read a quote from you in the Boston Globe the other day saying that even amongst those that are in the pipeline's not your word, but mine, a very small number of those who have met all the criteria are minority owned or have some minority ownership. So
it's far too low, in my opinion, and we've been very clear about collecting that data and releasing it, which other states haven't done. I think that's something we've learned. And that way we can try different approaches. So I'll tell you about what we're trying, but most importantly, we can look at the data and see what's working and what's not.
But one of the things that I thought you were going to try, which requires less capital investment, which makes it more likely that people from communities that have suffered under this can do it, things like the cafes and delivery services, they've been backburnered by the commission. We had this discussion with your chair, Steve Huffman, a couple of months ago here. They've been backburnered, have they not?
I would call it a phased approach. So we are currently developing regulations around delivery and social consumption, or we're approaching those 2. And you're absolutely right. They're lower capital, and we can build them as licenses that are for small businesses, for people of color, from those groups that are not currently included in the industry.
Okay, so you're sitting in that exact seat in a year. We have 2 pot shops now. How many will we have in a year?
I can't predict that.
How about, will we have implemented in a serious way the social equity part of this by then, or will we still be saying we're working on that?
If it's up to me, not only will we have implemented it, we'll have funded it properly. That's extremely important. And we have to make sure that this isn't a one-size-fits-all program. There are people who are looking for jobs, entry-level,
Understood.
re-entry level. There's a pipeline to more experienced jobs, and then there's ownership as well.
So can we move now to your private capacity?
Sure.
You're an advocate. I don't know if it's for legalization or decriminalization of all drugs. Which is it? Is it legalization, or it doesn't matter at this stage?
Those terms are not precise. It's really taking out the criminalization.
And what's the argument for everybody sitting at home totally aghast? What do you say to them? What's the rationale? What's the argument for this?
So prohibition has not worked. We've tried it, and the data shows that education, prevention, treatment, these things work. And so the idea is that instead of arresting people and putting them in jail, we wouldn't be necessarily having everything look like marijuana legalization, right? It depends on drugs. Drugs have different levels of risk. And so accordingly, it would be public health experts, public safety experts, who would be able to implement a system where you could buy a regulated product, not from the illicit market.
You know, I'm guessing that every public official who was sitting in your chair after you was going to go, oh my God, are you kidding me? However, what I think I'd say to them, and tell me if this is off base, almost everybody supports the Gloucester Angel program, which we've talked about a lot, which is a variation on a theme. You're an addict, you go in there, you turn in your paraphernalia, you agree to have counseling or work with a, quote, angel, and you're in the public health rather than the public safety, the criminal system. Isn't that a variation on the same theme?
That's absolutely a variation on the same theme. And there were people before that program who would have said you're enabling drug users. This isn't going to work.
The two primary arguments, one I know you hear all the time is, oh, all that's going to do is cause people who would not otherwise use to use. You can answer that in a minute. You can also respond to Charlie Baker from the Herald when a bunch of legislators went to Portugal, where there is decriminalization since 2001. I'm open to thoughts and ideas, says Governor Baker, but I would argue that we have had a system in the U.S. called prescribing, which was legal, and that created the crisis we have now. So I'm going to be kind of a hard sell on this notion. What's your response to the more people will use and then to Baker?
Well, I think that when you look at some place like Portugal, there was concern that we would be enabling drug users, that drug use would go up, that the negative impacts of drugs would go up. And we haven't seen that happen.
But do facts matter here? I mean, I think
I
can't remember in the gubernatorial debate that Marjorie Egan and I did. We either asked or intended to ask. I can't remember about safe injection sites. And at least the data that I had seen from Vancouver, which you know better than I, is within a radius of X hundreds of yards. The number of overdoses compared to the other rest of the city was down dramatically. There was overwhelming evidence there that at least it was worth a try. It's been rejected almost out of hand. So aren't facts often alien to the debates you've been having for a couple of decades? Look at the smile on your face.
That's such
about
a great
drugs.
question.
That's true, isn't it?
I think that it starts with having a fair conversation. And when Governor Baker says, I'm open to thoughts and ideas, that's the most important part. And I was appointed by Governor Baker, and we had a lot of these conversations. One of the great things about marijuana legalization is that we can now collect the data and we can have a real conversation that is based on evidence. And then we can move on to talking about these different approaches.
So a little Nostradamus before you go. You wouldn't give me a prediction about pot shops and equity. In your lifetime, will there be legalization or decriminalization of all drugs in this country?
I say yes.
I say yes, too. Nice to see you. Pleasure to meet you. Good luck, Shaleen, with all your work.